Hello. Thank you for allowing us to present our abstract here today. My name is John Stoffel. I'm at the University of Michigan, and I'm going to be presenting our work on associations between MRI and urodynamic findings among multiple sclerosis patients with urinary symptoms. This is the work of Nadia Sion. She was a medical student who worked with us. These are my disclosures, as you can see. Now, for background, MRI is the preferred imaging methodology to establish multiple sclerosis diagnosis. It's also very commonly used by neurologists to monitor the progression of disease. As many of us know who see these patients in clinic, urinary symptoms are highly prevalent within the MS population and quite bothersome. There's some studies that suggest that about approximately 80% of newly diagnosed MS patients and almost close to 100% of patients with longstanding disease will experience some type of urinary issues that impact on their quality of life. Now, as urologists and urogynecologists, urodynamic testing is frequently performed for these MS patients to really better understand the bladder physiology and to develop a treatment plan. However, there's not a lot of data to show good associations between MRI lesions and locations and the urodynamics findings. So this was the goal of our study, was to investigate whether the type and or location of MRI lesions are associated with specific UDS findings among MS patients. This was a retrospective study from our institution at the University of Michigan. Evaluated all MS patients who had urodynamics between 2010 and 2017, and the patients who had a concomitant MRI during this time were included. And so this was within a couple of months or at the time of urodynamics to be included for the analysis. MRI studies were reevaluated for this study by a multiple sclerosis neurologist, and the lesions were categorized by their location and presence of a T1, T2, or post-contrast finding. All the urodynamic studies had been performed with a standardized protocol by FPMRS trained faculty, and for this study, we reread all the studies also to update and to confirm the findings. We also looked at associations between lesions and urinary quality of life and compared the results of the AUA symptom index and also the ISI questionnaire. So 31 patients met the inclusion criteria, and you can see the demographics here. Little bit less females compared to other cohorts at 58%. And you can see here that the average MRI lesion per study was 2.3, which gives us some data to analyze. You can see here the distribution of the lesions, and there was a good distribution with large numbers in the frontal, brainstem, cerebellum, cervical spine, and thoracic spine. You can also see a large number of T2 lesions were noted compared to T1 lesions. The urodynamics also showed a good distribution of data. The capacity here, as you can see, ranged from 90 to 720, and the compliance for the most part was fairly normal with a few outliers. If we broke this down by diagnosis, you can see that the most common findings were detrusor overactivity and detrusor sphincter dyssynergia. Now, when we performed our analysis, the univariate analysis showed that the presence of T2 lesions on MRI was associated with detrusor overactivity. This was statistically significant. However, we did not notice any association between T1 lesions or post-contrast MRI findings. We also were not able to show any association between lesion location and any bladder-specific pathology or pathophysiology. When we looked at quality of life scores, you can see on the left for reference what the scores were of a moderately bothered cohort. There was no association between lesion location and low score on AUA or ISI, or lesion location or lesion location on any questionnaire. The thing that was significant, we did note, was that patients with low quality of life did have detrusor overactivity, but this was to be expected. And so In conclusion and discussion, in this cohort of patients with longstanding multiple sclerosis, we were able to demonstrate that T2 lesions were associated with detrusor activity in urodynamics, but could not make any other associations between other lesion type or location. This was limited by sample size and the limits of a retrospective analysis. But this really does highlight the need for more dynamic imaging that reflects real-time changes in bladder physiology of storage and emptying. This is my contact information, and I'm happy to discuss this more. Thank you for listening.